Hello all, a warm welcome to all my viewers. So today in this video I am gonna elaborate aftercare measures to be followed and taken care of after you undergo a hair transplant procedure. So these are simple but very important measures which if followed will give you very good results. So after the procedure is over, you will have a dressing over the back of your head which is to be kept for the next 2 days. The grafted area, that is the area where we have placed the grafts, is left open, as any dressing or cloth will stick on the grafts and cause them to pull out. You will be given a surgeon's cap from the center which has to be worn loose over the grafts, and it has to be worn only while you are out where you expect some dust and pollution. Otherwise, during most of the day, avoid wearing it, especially when you are indoors. When you wear the cap, make sure it is loosened from the back and it just sits passively over your head. Do not adjust or move the cap. Avoid rubbing or pressure on the grafts. You will be provided with a spray bottle filled with saline with which you have to spray the grafts every hour for the first 3 days and then every 3 to 4 hours for the next 2 days to prevent dryness and itching and to keep the grafts moist and hydrated. This measure increases the viability of your grafts by not making them dehydrated, which if dehydrated will be very detrimental for the growth of your grafts. So now once you're back home, you have to take rest the same evening and also the very next day. You can have a light dinner, whatever suits you. Stay away from alcohol consumption at least till the time you're on medicines. Smoking isn't good at all for your new hair follicles, which are expected to grow in due course of time. It compromises the blood supply to the scalp, causing poor cell growth, which in turn results in poor growth of your hair. If at all it can't be stopped, in that case, you have to refrain from it at least a week before and a week after the procedure. Remember to have your evening medicines as prescribed, which contains an antibiotic, painkiller and a steroid. Steroids we give to help for early healing and to prevent swelling. As we all know, the more the swelling, less the healing and more fibrosis. Therefore, for good results, swelling should be minimum. Antibiotics have to be taken for the next 3 days. Painkiller can be stopped from the very next day, as we don't anticipate much pain in our technique of hair transplant except some minor discomfort which usually settles in 2 to 3 days time. You can do your routine work in any dust-free AC areas. For our client who are into regular workouts, no workout is recommended for few weeks after a hair transplant, as any increased cardiac activity might cause bleeding at the surgical site and disturb your grafts. Also, sweating due to workouts will compromise the hygiene of your scalp, which again is not good for your transplanted hair. Cut your nails short to prevent accidentally scratching the grafts or your donor area. We also advise firm finger massage from mid forehead to the sides for 10 minutes 3 times a day for the next 5 days to avoid any swelling in the grafted area or the forehead. We don't recommend ice application to suppress the swelling, as swelling is not much in our case and ice application isn't required. In fact, it might mess up the grafted area. You have to sleep with your face up or propped up position with 2 regular sized pillows to avoid any swelling. Don't sleep on the side of your face for the first 3 days. To make this convenient, you can make use of a traveling pillow while sleeping, which ensures to keep your face up and avoid it from going on the sides, as that might disturb your grafts in case your pillow rubs on the grafts. On the next day of your transplant procedure, you have to continue with your medicines and keep spraying the grafts as advised. Painkillers to be taken only if required. In case of mild discomfort, avoid taking it. Medicines advised after the transplant are for the next 2 to 5 days. From 6th day to 10th day, there is no medicine. After 10 days, start all your hair growth medicines and continue your regular hair care program. At times, you might have itching which is caused by dryness. In that case, you can apply Vaseline body lotion or Ultiderm lotion, or you can have tablet Allegra 120 mg twice a day for around 3 days to reduce it. Dressing on your donor area has to be maintained on 2nd day as well. It has to be removed only on the 3rd day. No head bath for the initial 3 days after transplant. It has to be done on the 4th day. I'll elaborate on it a little later. Today, that is around 48 hours after the transplant procedure, you are supposed to visit the clinic for your dressing removal and follow-up. Now in case if you can't manage to come to the clinic, like in cases of our patients staying in far off places, we shall explain them the procedure to remove the dressing at home itself, which again is very simple. On third day, again you have to take your medicines as advised and spray your grafts. Today, that is fourth day after your transplant procedure, you are supposed to have a head bath with medicated shampoo. Shampoo will be provided from the center. It has to be diluted with water in a bath tumbler. Gently poured and spread lightly with fingers flat over the scalp and then washed with water. No shower to be used, only bath tumbler. Thereafter, dry the hair and the grafted areas gently by pressing or dabbing with a double folded soft towel. A very important point out here is that you are not supposed to rub on the grafts with your fingers or towel till 10 days after the surgery. You have to shampoo in the same way every alternate day, that is 6th and 8th day till 10th day. Today, that is 10 days after the surgery, it is essential to rub on the grafts gently with the ball of your fingers and remove any loose scabs over the next few days. Do not hold back rubbing the area thinking it will hurt the grafts, as your grafts now are healed and need to be cleaned. You can apply coconut oil a night prior to soften the scabs and make them easy to remove. Small 2 mm hair may fall off with the scabs. Do not worry, these will grow back after 4 months. No hair growth is seen up to 4 months. After 4 months, 1 to 2 mm hair start growing from the grafts and then continue to grow around a centimeter every month. More new hair growth occurs up till 9 to 10 months after the procedure. Rarely, you might accidentally scratch or pull out a graft, causing bleeding from the side in the initial days. If that happens, all you have to do is apply firm pressure for 2 minutes and bleeding will stop. You have to report to the clinic in any such event. So this was all about aftercare measures to be followed after your hair transplant surgery. Everything is explained in detail to all my patients by me and my team of associates to keep your recovery as smooth as possible. Any further doubts or questions regarding this, please ask us in the comment section below and we will answer it at the earliest. Do like this video and subscribe to our channel for more such informative content which will be of a great help in your hair loss journey. This is Dr. Rahul Jagiasi signing off. Bye bye.